Brain fog and feeling like you're not just quite right after a brain injury, even months to years afterwards, is probably caused by an unresolved deficiency in a visual processing skill. What often happens after a brain injury is you get a deficiency in convergence insufficiency. It's essentially when your brain has lost its ability to calculate near space. So when you go to read, do work on a computer, and get back to work, you are having to physically work harder in order to collect the data that is on your computer screen, on your book, on your file, or whatever you're studying. Because when you look up close, you misalign where your eyes should be. It'd be kind of like trying to walk when your posture is off. Everything becomes harder. The brain fog, problems with decision making, feeling like you have short-term memory loss, maybe even just feeling off in your space or feeling slow to respond, is just a result of you constantly having to work harder to even read the email, process the email, collect the information. Again, this is present in over 50% of post-concussion syndrome patients, and there's no evidence that shows that it will ever self-resolve without targeted vision rehabilitation. I've had patients who have struggled with this for decades after a concussion, with it being completely missed by all of their other doctors until we did a few quick measurements. So you do not have to suffer forever. You are not crazy. And these are things that will not show up in an MRI, blood test, or any other kind of testing. A binocular vision evaluation with a neuro or developmental optometrist will catch this.